Okay, thank you so much, guys. We meet again in my channel where we teach you about the health, we teach you about wellness, about drugs, how to use the drugs, what are the side effects and what are the benefits, and also some advices regarding your health. So today we are going to be talking about the drug ibuprofen and aspirin. So these drugs are used for the treatment of inflammation and pain in your body. So I'm going to talk first about what is inflammation. Inflammation is the swelling that happens in your body as a result of injury or some serious diseases. And pain, everybody knows what pain is when you feel some pain. So what really happens when you feel some pain and when you feel inflammation in your body? So there are some enzymes that are inside our body. These enzymes are called cyclooxygenase. So what do cyclooxygenase enzymes do? Cyclooxygenase enzymes, they are responsible for the production of the hormone that we call the prostaglandins hormone. So what does the prostaglandin hormone does? The prostaglandin hormone promotes pain in your body, and it also promotes inflammation in your body. So when you feel some pain, just know there's some prostaglandins that is in action as a result of the enzyme cyclooxygenase enzyme. So this is the same with the pain and also with inflammation. Now let's talk about what happens when you take this drug called aspirin and ibuprofen. So when you're a patient, or maybe your child, your parent, or maybe it's you get hurt or you're injured, maybe you fell, you're exercising, or whatever you were doing, then you can feel that I feel some inflammation, I feel swelling, and also I'm feeling a lot of pain. You visit your doctor. Your doctor diagnoses you, then he sees that you have really some inflammation. You're really feeling inflammation and also a lot of pain. So the doctor directs you to a pharmacist, and of course he writes a prescription that is a written statement whereby a doctor writes all the necessary treatment that you need. So you visit your pharmacist. The pharmacist then give you this drug called aspirin and ibuprofen. Now what happens when these drugs are now inside your body? This is where the curiosity is. Everybody is always curious. I am also curious. I was also filled with a lot of curiosity. What happens when this drug gets inside my body? I always take this drug. I take a visit. But what really happened? So when you take an aspirin or an ibuprofen drug, remember these are non-steroidal anti-inflammatory drugs. They are mainly for the treatment of inflammation, and they also treat pain. So when they are now inside your body, they go and they inhibit or they stop the action of cyclooxygenase enzyme inside your body. So when cyclooxygenase enzyme is inhibited or stopped from action, of course, so that means also the production of prostaglandins is inhibited or is stopped. So when prostaglandin is stopped, that means there is no more promotion of pain, there is no more promotion of inflammation, since prostaglandin hormone is the one that is responsible for the promotion of pain and inflammation in your body. So this is what happens when you take these two drugs. You start feeling happy, you start feeling that my pain is gone. This is what would have happened. Cyclooxygenase enzyme is inhibited, and as a result it stops the production of prostaglandin hormone, and since prostaglandin hormone is being stopped, that means there is no more promotion of pain and also promotion of inflammation. Now, what are some of the activities that you can do to reduce some inflammation in your body? There is one treatment that is mainly common to athletes. You can also use this at home. You can, as a parent, you should know this so that it will help you one day when your child is feeling some pain or you can see some inflammation, you can do it. It's called the ice treatment method. So what really happens? You take a cold ice, and you apply it at the site of inflammation or site of pain, when you apply an ice, some cold temperatures where the inflammation is there and also where the pain is there, the cold temperatures, they stop. They actually reduce the flow of blood to that site of pain. So when the flow of blood is reduced to that site of pain, that also results in the reduction of inflammation and pain in your body. So you start feeling better. So use this technique, use this treatment, and it will help a lot. And also there is one other thing that you can do to reduce the effects of all these inflammatory diseases that actually affects many people. There is one, it's called exercise. Practice this thing a lot. Exercising helps you a lot. It's like our body has been designed to do work. We've been designed to work each and every day. So when you see yourself not working, not doing anything, that is not good for your health. Always find some time to do some exercises. It helps to reduce the effects of inflammatory diseases in your body. So do some exercise. When you see yourself with some inflammation, remember, ice treatment is also something that you can use. You can call it first aid. And also remember to use this drug all the time according to what is written on your prescription, because they have serious side effects. So I'll talk about the side effects of aspirin drug. One that is mainly common, but it doesn't happen for a lot of time, but as long you continue to use according to what is written on your prescription, you will not face any problem. But there are some, maybe because of maybe some problems, they forget. We have a lot of stresses out there. So I'll tell you. So what does aspirin have? What are its side effects? So one of the side effects of aspirin is the erosion of the acids in your body. It erodes the acids inside your body, and when these acids that are inside your stomach, I said inside your body, that are in your stomach are eroded, it results in what you call ulcers. Most of us know that ulcers are not friendly at all. So apart from ulcers, it also causes hemorrhages. That's bleeding inside your stomach. So you start seeing sometimes when you go to the restroom, you find out that your waist contains some blood. That is because of maybe overdosage of these anti-inflammatory drugs, of which today we are talking about aspirin and ibuprofen. So what is one thing that you should always do? Always follow what your doctor has said. And one thing, always visit or consult your doctor before usage of any of these drugs. One more thing, if you have any complications in your body, maybe you have some other diseases that you have, or you have some other treatment that you are going on with you, make sure you consult the doctor before you buy any type of a drug.